Thanks. And so the final breakout group was on the role of public health. That was led by Bobby Pestronk. So Bobby, take it away.
Here's the prop. Did somebody leave their glasses up here?
That's me.
Okay. Yeah. Our group was on the role of public health. We spent some time thinking about what does public health mean and who is public health. And we thought that, or at least it was offered that a useful distinction would be to, first of all, I guess I got to move these, huh? First of all, it would be useful to make a distinction between governmental public health organizations and agencies. At least in that community, they often think of themselves as public health. And then think about public health from a more collective action approach, and to then discuss what the role of public health might be from both of these, from each of these perspectives, because they could be quite different or they could line up very well. But there are challenges in each approach, and it would be useful to know about those. So in terms of the governmental public health, there was, I think, some acknowledgement that both local public health department staff and state chronic disease directors who may have vision, might have vision on their agenda or might be asked to have vision on their agenda, already have a loaded plate. There are, I mean, for example, we saw the totality of the CDC vision staff here today for a national problem of the significance and salience that was discussed. There are 3 people focused on that at CDC. In many state and local health departments, there probably aren't even a part of a person who are giving that priority and focused on it. So what could be an approach that might work with state and local health departments in particular? And that might be that there are many groups that, for example, I'll show you in just a second, under the collective action approach, who already have resources and networks and deep interest in the area of vision health. And for those groups to identify themselves to local and state health department directors, either of chronic disease or of a department. You know, departments are of different sizes and shapes and scale, so it would depend, the approach would depend on who might resonate with that approach. But that might let governmental public health departments know that there are many resources out there already and many people interested in this area already, and help them then be part of, in some fashion, what is the next kind of approach, which is a collective action approach. But let me go to this first. In terms of local health departments in particular, but also state health departments as well, there has been a drive over the last decade to have state and local health departments organizationally and in terms of the services and approaches that they take be more homogeneous. But these state and local health departments are creatures of their communities. They are creatures of their state constitution, and they are creatures of their local governmental bodies. And so they act differently and perform differently, and some of them, many of them, whether rural or urban, big state, small state, have taken approaches to health problems where vision might be an analog. They have taken approaches to health problems and challenges that have been very successful. And it might be useful to identify what approaches have been taken there and figure out why they have been successful, and then adopt those very local and very state-specific approaches to this area of vision related challenges and translate those into vision-specific solutions. And then with respect to the federal level, it was recognized that although a lot of time has been spent thinking about what CDC should do and shouldn't do or should do more of, or that there actually is no single federal health department. Even HHS isn't a single health department. And so there are many federal players, and a number of them were identified within HHS, and it might be useful to think about what approach they might take specifically on this issue as well. In terms of collective action, there are 2 slides here, and I won't read them all, but I'll just mention a couple of ideas that came up in the discussion that our organizations, through a collective action approach, which is one where organizations come together with to develop, first of all, a shared agenda, to agree on the resources that they would share to implement that agenda, even though that agenda might not represent the totality of any particular organization's agenda. Much discussion here today, both in the groups and earlier, was on developing a shared message. For example, there was a very interesting presentation about the work that community health centers are doing in North Carolina in this regard with respect to hospitals, nonprofit hospitals, nonprofit hospital systems in communities. They are required to do a community health assessment and to develop a community health improvement plan within their communities. And if vision can be somehow added into that agenda, either by the use of data specific to communities, then you would have a constituency that otherwise might not be paying attention to vision as a problem, beginning to pay attention to it, because the community and the process that had been used in the community to identify vision would be demanding that be addressed. Sometime and mention of faith-based groups, recognizing that these primarily religious-based organizations of various kinds can reach populations that are otherwise unreachable, and can reach them through spokespeople whose messages will be heard, whereas they may not be heard from other people because the messengers share an ethos with the members who are listening. And then this long list of other organizations that could be part of a collective action strategy, because something about the work of those organizations and the people in them has a vision, would resonate with a vision-oriented approach. One idea that I'll share that came up at the is at the bottom of this list, and it is teens and technology. Of course, teens will become us older people one day. They're also a generation that's grown up with a different kind of technology than we're used to using, and we might challenge teens to figure out ways in which we can reach them and therefore breed a generation that is more interested in and more attuned to the kinds of vision problems that they will experience or that their other family members will experience. And there might be, through one or more of the organizations that are in this room or that are on this collective action list, a contest that might be sponsored to develop an app in this regard, or apps in this regard, and then to promote them more widely among teens and others. We talked about, there's just more agencies and organizations, some of which might not necessarily come to mind in any discussion about vision, but in at least one case have an intensively captured population that might have needs and might be easy to deal with them because they're not going anywhere for a while. In terms of system changes that are needed, we have the systems and the fragmented approach that we have and the lack of the coordinated approach we have right now, because we have the policies and incentives that have been developed to give us what we have right now. And a systems approach would ask us, why do we have what we have right now, and are there levers, long levers that can lift heavy weights and heavy challenges to change what we have now, and not only to create a real system that would exist in the ways that it was defined this morning, but that also would survive over time against forces of inertia, which will always push back into the kind of categorical approaches that we typically have here. And that those usually involve both positive incentives and negative incentives, which are regulatory and financial, and that exist all across our payer systems currently. And so, because we have created those systems, they're amenable to change if we can organize ourselves effectively to do that, which is, of course, what the collective action approach is about. We think that, or at least there was a suggestion that over the next couple of years, while over the past few years there has been an approach to encourage state and local health departments in particular, and traction at the federal level to expand thinking about how to approach health problems and how to look at health problems in a collective way, that over the next couple of years, as budgets are cut, there's going to be a pressure to return to traditional public health issues of infectious disease, and that we may want to understand what local levers exist for capturing funding locally to address some of these issues, and how to encourage at a local and state level this health in all policies approach that could be effective, and then to identify health departments that have good models that may not be vision specific but are amenable to an element which would better address vision challenges than in the case right now. And lastly, an observation that's been made a couple of times today, that despite our current efforts, tremendous inequality and inequity in vision and the ability to see well persists, and that those disparities need to be spoken to and addressed directly and given direct priority, because fundamental to reaching the populations that are the hardest to reach is that those populations both don't hear from and don't trust the organizations that have been established to address their needs. And there are personal experiences where unlikely messengers who finally speak to the challenges that particularly people of color and other disenfranchised populations experience in this country, once they start to speak to those issues, it comes as a great surprise that unlikely people in positions of power would be aware that that's the case and are asking for help solving them. And that's the trust that's needed, in part, to create the political and other leverage that's necessary to address the disparities. So I'd ask my colleagues whose suggestions I probably have inarticulately and incompletely represented to speak up about anything that needs to be said in addition. Thanks. Thank you.
I guess you captured it all. Thank you, Bobby. Well, it's been a great day. I've learned a lot. The agenda says next steps, and I think we've been talking about next steps all morning and all afternoon, and clearly there are next steps for all of us as to how to move this agenda forward and improve vision health, equity, vision equity in this country. So there's a lot of work ahead of us. The committee's work, as you know, finished up last September, and the sponsors, for whom we are most grateful, enabled us to have this workshop as well, which hopefully will be a springboard to action and collaboration. We heard the opportunity sort of across the spectrum of prevention and treatment, upstream determinants, communications, collaborations, guidelines, so no end of things for us to work on. But I want to express my appreciation, first of all, for all of you for sticking it out all day. It's been highly informative. And of course, express my thanks to the committee members who are here and their participation all along. And of course, lastly, but not least importantly, but absolutely essentially, to the folks here at the IOM, now NASM, who have made all of this work possible. Meg is here. We introduced you this morning. She was the study director in the back, so thanks to you. And to Rose, who organized the day so expertly, so we're appreciative to her. And of course, the staff. And Rose, before I let everybody go, is there anything else that you would like us to say or do? You're in the Klieg light, so I can't really see you. I think you're good. All right. Well, again, thanks to all of you, and safe travels. And with that, we'll be adjourned. Thanks much.
Great, thank you.